The future of healthcare will not be built only inside hospitals. For over a century, we have designed healthcare around buildings, clinics, hospitals, and laboratories. But infections, fear, and human behavior do not respect walls. Antimicrobial resistance, AMR, is not a distant threat. It is already quietly and relentlessly reshaping medicine. Treatments that once cured are failing. Surgeries once considered routine now carry a growing risk. And in the coming decades, this silent crisis will redefine how societies survive illness. Yet our response remains reactive mainly. We wait until people are sick enough to enter hospitals. We wait until outbreaks escalate. We wait until healthcare becomes expensive, overcrowded, and inaccessible. That model is no longer sufficient. The future of healthcare must move closer to people's daily lives, into streets, pharmacies, villages, markets, transport hubs, and workplaces. Where illness begins, not where it ends. This is where the idea of the Dr. Maya AI kiosk network was born. Not as a replacement for doctors or hospitals, but as a missing layer in the healthcare ecosystem. A decentralized, community-level early warning and guidance system. A place where people can identify early signs of infection, receive isolation and safety guidance, understand when they genuinely need medical care, and avoid unnecessary exposure in crowded healthcare settings. This is not only about access. It is about behavioral change at scale, which is the single most potent weapon we have against antimicrobial resistance. When infections are identified early and managed responsibly, transmission drops. When transmission drops, antibiotic misuse drops. When misuse drops, resistance slows. This is how millions of lives can be saved, not through one miracle drug, but through systemic prevention. But there is another truth we must face. Public health solutions that depend only on donations, government funding, or goodwill do not scale fast enough. They remain pilots. They remain fragile. They remain dependent. For healthcare protection to reach every street and village, it must become economically self-sustaining. This is why I created Dr. Maya AI Kiosk and the SamsaRx booth. They are not just public health innovations. It is also designed as a future-ready business infrastructure that offers compassionate, accurate, logic-based management advice. This is what I call CALM, the clinical anxiety and life-saving medical triage to help initially identify infected individuals and isolate them to prevent epidemics and pandemics. Owned and operated by families, entrepreneurs, pharmacists, and community partners. Each kiosk becomes an SamsaRx booth, the health protection point, a digital awareness center, and a source of sustainable livelihood. This alignment is intentional. Because the most resilient systems are those where doing good and doing well are not in conflict. In this sense, the Dr. Maya AI Kiosk franchise represents something larger than a product or a platform. This is not a short-term venture. It is generational infrastructure. In the same way, electricity, clean water, and telecom once reshaped societies. Decentralized AI-driven health guidance will become a basic civic necessity. And those who help build it today will not only be protecting their families, they will be shaping how healthcare itself evolves. We often ask, how will we survive the coming healthcare crisis? Perhaps the better question is, will we build systems that make survival ordinary rather than heroic? That is the purpose behind Dr. Maya AI and the Kiosk Network, and so I am inviting you to start a conversation with me. If you were aspiring to be a doctor but failed, and you believe this is a noble profession that you dream of, this is the best option. You are not inflicting fear, hoarding wealth and power, but helping alleviate it through Dr. Maya, which will bring tears of happiness in the world. And you are also adequately rewarded for your contribution. You will not only help your loved ones, but will also never suffer when the going gets tough. Scan the QR code to learn more. Thank you.